National Capital Region are breathing poison. Children are being forced to stay home. They can't go to the playgrounds. They can't go to school. They have to be within the confines of their homes because their life is in danger. This is nothing short of being betrayed year after year as air pollution only soars. This is not a story of just children. This is the story of every elderly person in the National Capital Region. This is the story of every young person. The WHO clearly states, in fact, the permissible PM 2.5 levels. And Delhi, during peak smog time, has 30 to 40 times more than the permissible levels. And that could just be one of the reasons, even if you don't smoke, why do your lungs look like that of a smoker? Why are we talking about this? Delhi's air pollution crisis is far from under control, and the latest admission by the city's environment minister, the capital's environment minister, has only exposed the scale of the failure. After several days of denial, the Delhi government environment minister, Manjinder Singh Sirsa, has conceded that air pollution remains a serious challenge and that it is impossible for any government to bring down AQI levels within 9 to 10 months. He has offered an apology.
दिल्ली के अंदर मैं एवरेज AQI की बात, जैसे मैंने पहले भी कहा था, हर महीने हम बेहतर देने में कामयाब हुए। मैं दिल्ली के लोगों से माफी मांगता हूं, इतना कहना चाहता हूं। 9-10 महीनों में कोई सरकार आपको पूरा का पूरा पोल्यूशन को साफ कर सके, ऐसा असंभव है। लेकिन मैं दिल्ली वासियों आपको बताना चाहता हूं, आम आदमी पार्टी की सरकार जो बेईमानी करके चल कर गई है, हमने उससे बेहतर करके हर दिन का AQI कम करा है और इसी तरह अगर कम करते जाएंगे तो ही दिल्ली को साफ हवा देनी संभव है। ये 12-10 साल की आम आदमी पार्टी की बीमारियां, 11 साल की और 15 साल की कांग्रेस की बीमारी जो है, जो अभी राहुल गांधी और प्रियंका गांधी जी मास्क लगाकर कहने की बातें कर रहे हैं। मैं राहुल और प्रियंका जी से पूछना चाहता हूं, कहां थे आपके मास्क पिछले साल? पिछले साल इससे ज्यादा पोल्यूशन था, पिछले साल इससे ज्यादा गंदे दिन थे। पिछले साल आज के दिन भी अगर हम बात कर रहे हैं तो 380 AQI था, लेकिन ना राहुल गांधी आपको दिखे ना प्रियंका गांधी दिखे, क्योंकि ये आम आदमी पार्टी के लाभ साफ लोग मिले हुए लोग थे और आज इनको ये सब बातें याद आई हैं। बिल्कुल पोल्यूशन दिल्ली में है, पोल्यूशन की बीमारी दिल्ली के कारण बच्चों की सेहत के ऊपर खात्मा कर रही है, नुकसान कर रही है, लेकिन ये बीमारी आम आदमी पार्टी की हमें दी हुई है।
मुद्दा उठाया था, क्या कहेंगे?
माफी मांगने का क्या फायदा है, काम करें, ठीक कराएं। हमने कहा कि सब इकट्ठे होकर हम कुछ अच्छे ठोस निर्णय लें, लेकिन यहाँ तो चर्चा भी नहीं हो रही है उस पर।
Well, I'm being joined by Vimlendhu Jha, who's an environmentalist, as well as Dr. Vivek Nangia, Vice Chairman and Head for Pulmonology in Max Saket. Thank you very much, both of you, for joining me. It's been a while since I've seen you both. Vimlendhu, my first question to you, before even I ask any leading questions, just a very simple thing. As somebody who lives in the National Capital Region, what do you make out of a so-called apology by the Delhi Environment Minister?
I think the Environment Minister of Delhi, in that press that he apologized, as in, of course, it's okay and it's true that no one can solve this problem in the last 8-9 months. But if you look at his actual behavior last 8 to 9 weeks, in that sense, he completely denied that there was any problem and he thought it was all propaganda. Rich of him to today come and say that, yes, it's a problem that can't be solved in 8-9 months, but that apology alone will not fix Delhi's air. I think the concrete action that perhaps should have started 9 months ago, or perhaps 9 years ago, or whatever number of years that could be attributed to this, that proportionate action has not been taken, and just mere apology will not cut it for the lungs of our children and the elderly. Right now, what we need, and at the same time, I also need to tell you that this is not a Delhi problem, and I do not know why Mr. Sirsa should be alone, put in the dock in that sense, or Delhi's chief minister alone. Like your studio perhaps is in Noida, I live in Gurgaon. The entire National Capital Region's air is bad and terrible, and not just that, as North India's air is extremely terrible, and therefore we want the Parliament of India and the Prime Minister's office to really take concrete measures. And concrete measures is not just putting some sort of a stopgap. These GRAP measures were supposed to be only emergency measures, but unfortunately, what we've been seeing last couple of years, that our entire political class, our governance infrastructure, both executive and legislature, hides behind only these stop-gap measures as if that's the action. That is not action, that is reaction, that is only temporary, that is only precautionary, that is only to make, to help us in some way not make the situation worse. But we've seen that more than gap, there's nothing on ground. When we talk about public transport regime, when knowing the 40% of pollution, actually PM 2.5 is from the private vehicle sector, and therefore we have to enhance the public transport infrastructure. Nothing concrete has actually happened in this region. When we say that PM10 to almost at whatever, 20 to 30% of the pollution is from construction, demolition, dust, we haven't seen much of that. And also denial. I think one thing very, very important that we have to see it in the same breath, that union minister saying that no one dies or falls ill. And today, and in fact, earlier to also say that our standards need to be very, very different and there's no pollution. At least the minister today said that there is pollution in that sense. Of course, fudged data, sprinkled data, but calling out that entire misgovernance or lack of political will and political urgency is extremely important.
Right. Dr. Vivek Nangia, you just heard Vimlendu. You've also been seeing what's happening around. I mean, let's just look at some very hard facts. 90% surge in chronic respiratory and cardiac illnesses being reported in OPDs is what I am being told. That's the data that we are getting from hospitals across the National Capital Region. Just how severe is the situation that you're seeing around you?
See, the situation is quite severe. As it is during winters, the number of cases coming in with acute asthma, acute COPD, they do rise. But this time we are definitely seeing a distinct rise as compared to the previous years. In fact, over the last few years, the numbers have only been rising of, all these air pollution related diseases. COPD, like classically was considered to be a smoker's disease. Now we see a lot of them in non-smokers also. This is the time of the year when we are seeing lots of new patients, those who've never had a problem with cough and cold ever before are now coming in with cough, cold, chest congestion, tightness, asthma-like features. And the worst is that, they're not improving with the medication that we give them. So invariably, they're having to be receiving long-term steroids, long-term antibiotics, nebulizers, and all that. In fact, some of them are even requiring hospitalization because of the acute severity. And then again, those who already have an asthma or COPD, they're also experiencing increase in their symptoms. So for them, we've always been recommending that please carry your extra inhaler with you, the rescue inhaler with you all the time. But despite that, sometimes they land up in emergencies, in problems, and we have to tackle them then. There are studies which have shown that whenever there's a rise in PM 2.5 particle, there's a distinct rise in the number of people getting hospitalized with acute emergencies of asthma, COPD, and even heart attacks for that matter.
Vimlendu, just bear with me. Let me just go with one more question with Dr. Vivek Nangia. And this is the harsh reality. Every household which has a child, particularly if that child is possibly below the age of 5, in most cases is using a nebulizer in the National Capital Region. It's very hard to find a child below the age of 5 not using nebulizers in the month of December. This is nothing short of literally snatching their right to life from them, Dr. Vivek Nangia. Just how real is this?
So again, this is quite a realistic kind of a situation. If you see, there are studies which have been conducted comparing the lung function of children in Delhi and those in Mysore and other places in southern India, where there is relatively lesser air pollution. And the studies have confirmed that the lung functions here in Delhi were poorer than of the children down there. So definitely the AQI is impacting the lung functions as well. Well, these were all in the grown-up children, but even less than 5 years are very, very prone to developing respiratory tract infections, allergies, asthma. In fact, why talk of 5 years? Let's talk of pregnant ladies. The child is still not born. And even an unborn child could actually be affected with a low birth weight, premature birth, death, intrauterine growth retardation, poor lung function developments, and so many other complications that you can imagine. In fact, now, even mental retardation and mental slowing in children is being associated with the air quality outside.
This is hugely troubling, but Vimlendu Jha, it seems that the political class of India is not really bothered. It's just not a real challenge for them. They have other things to discuss.
Absolutely. So me and Mr. Dr. Nagia had been on television shows for many, many years. In fact, I've also taken medicine from him, and I think I'll ask him tonight again that I had lost my voice, 90% of it. I
I
haven't been able
remember.
to recover it. And reality is that everyone, I'm sure at your studio, at workplaces, I'm sure Dr. Nangia also is not immune. Just because he's a doctor, that doesn't mean the air doesn't affect him. I can see that he's also losing his voice in that sense. So reality is that our doctors this year, Dr. Nangia, for sure, for half a decade at least that I've been hearing him, have been talking about the impact this has. But our parliament tells us, our minister on the floor of the house said that no one falls ill or no one dies. And if that kind of a dishonest criminal admission or submission is made in the place, in the temple of our democracy where policy is made, how will we actually be able to make any progress? Progress will only happen when we accept that there's a problem. And here there's no propagandist. My complaint cannot be dealt with as conspiracy. Dr. Nangia's suggestion from a scientific temper and medical science point of view cannot be thought as conspiracy. All of us are only thinking about the well-being of our children and of our nation. And of course, right now, Dr. Nangia is talking about the health impact this has. Also, by the way, I'm sure he will tell you more that in short term, of course, a nebulizer and a steroid can perhaps rescue you. It's an immediate emergency rescue, but the long-term impact that perhaps these steroid and other antibiotics and these chemicals would have. So therefore, the loss of life, emergency breathing ability can improve, but in long term, subjecting yourself and normalizing nebulizer and inhalers as the way of breathing, because that's what we are saying, that it's how we have actually made water purifiers part of our life as a culture, as we have accepted that water that the municipality will supply to us will always be bad, and therefore let's find a private water bottle or a water supplier. Same thing we are doing with air. The only issue is that air is invisible and we can't tell how bad the air is, and the poor that gets most affected.